After studying this module, you shall be able to know about the significance of non-metallic poisons, some notable non-metals responsible for significant poisonings, and their forensic importance and examination. There are innumerable substances which can be included under the term inorganic non-metallic elements. The important poisons in this group of non-metals or specifically toxic anions include borate, bromide, chloride, cyanide, fluoride, hypochlorite, iodide, nitrate, nitrite, oxalate, bromate, iodate, sulfide, thiocyanate, etc. Generally, the anions in these salts are responsible for the toxic action. Consequently, their detection gives a clear idea regarding the source of poison. Sometimes, toxic anions are directly used as active species such as cyanide, oxalate, borate, etc. These cations and anions are to be isolated, especially in the case of biological materials, for onward detection and estimation. There are some classical methods like Rains test, Goodsit test, Marsh test that are still followed for the detection of cations. The present day analysis includes micro methods and instrumental techniques. Toxic anions and nonmetals present an analytical challenge. With the exception of phosphorus, these agents are rarely encountered in an uncombined form. Some anions which can be trapped in combination with a stable cation, after which the organic matrix can be destroyed, as with metals. Others can be separated from the bulk of the matrix by dialysis, after which they are detected by colorimetric or chromatographic techniques. The forensic issues. The systematic analysis of anions in the body fluids presents a major analytical challenge. Generally, the main approach was the analysis of stomach contents and seen residues using classic colorimetric methods. Many anions are unstable and undergo rapid breakdown in the stomach and gut after absorption. The analysis of metabolics and various hydrolysis products in blood or urine using modern methods is not well described. In some cases, the investigation of poisoning caused by anions that are oxidizing agents, for example chlorates, is best carried out by measurement of changes in blood chemistry such as the formation of oxidized hemoglobin, which is also known as methioglobin. The development of analytical techniques such as ion chromatography to separate and measure anions in biological fluids has been slow. However, the increased application of ICP-MS techniques has greatly enhanced the ability to detect the presence of elevated concentrations of particular elements, for example, bromine, boron and iodine in biological fluids and tissues that may indicate the ingestion of particular anions. Classic analytical chemical methods like color test may still be applicable for some cases in which stomach contents or seen residues are available. Some notable non-metallic poisons, for example, phosphine and phosphites. Phosphine is a highly toxic colorless gas with a strong garlic or fishy smell and is used in a number of industrial processes. It is also generated by the action of moisture on phosphites. Aluminum phosphide is used extensively as a cheap and effective grain fumigant and rodenticide in developing countries. Aluminum phosphide poisoning has a high mortality and in the 1990s saw a dramatic increase in the number of poisoning cases and deaths caused by suicidal ingestion, particularly in India. Signs and symptoms of poisoning include headache, nausea, vomiting, hypertension, which may progress to hepatic and renal failure. Methemoglobin formation has also been reported. Borate, boric acid, has for many years been used as a common household antiseptic for external use, but has generally been superseded by modern agents. Sodium borate, which is also known as borax, is still used in cleansing agents, contact lens solution, wood preservative, pesticides and fungicides. Compounds of boron have relatively low toxicity, and reports indicate that following a single acute ingestion, symptoms are often very mild. However, a number of cases of acute and chronic boron poisoning have been reported in children and adults. Signs and symptoms have generally included nausea, vomiting, diarrhea and abdominal pain. In some cases, the patients may develop a generalized erythroderma, sometimes described as a boiled lobster appearance. Seizures, coma and renal dysfunction have been described in more severe cases. Plasma boron concentration ranging from 200 to 1600 milligram per liter have been reported in children in fatal cases of acute poisoning and borates. Survival has also been reported in cases of adult poisoning despite admission boron concentration in excess of 1000 milligram per liter. Next, go to bromide. Bromide salts, for example, of ammonium, potassium and sodium, were first introduced into medicine in the 19th century and were used extensively as anti-nausea and anti-vomiting and sedatives. However, with the exception of organic bromides such as carbromal, a sedative, their use is now limited. However, potassium bromide may still be found in the traditional medicines used in the treatment of epilepsy. Bromates have been used as preservatives and detonators. Methyl bromide is a colorless gas, mostly commonly used as insecticidal fumigant for grain stores and soil, but has also been used historically as a refrigerant and in fire extinguishers. Methyl bromide releases bromide ion as a metabolic and is associated with accidental poisoning, particularly with an occupational setting. Absorption of bromide ion takes place rapidly from the stomach and proximal small intestine by passive diffusion. Bromide ions behave like chloride ion and are distributed mainly in the extracellular fluid. The most important route of elimination is via the kidney. Their elimination half-life is relatively long, being of the order of 10 days after acute dosing of several weeks following the cessation of chronic intake, particularly in the case of bromide intoxication. Bromide poisoning may cause complex neurological symptoms, and clinical diagnosis have been difficult if use of bromide salts is not suspected. Let's study about the cyanide. Severe or fatal cyanide poisoning is relatively rare and mostly involves suicidal ingestion of cyanide salts. Hydrogen cyanide is a highly toxic volatile liquid. Fumes of hydrogen cyanide are given off when cyanide salts are mixed with acids or produced in the stomach following the oral ingestion. Although hydrogen cyanide has a characteristic almond-like odor, up to 50% of the population are unable to smell it. Surprisingly, it was not a characteristic feature at autopsy of a large series of cyanide suicidal deaths, although this could have been related to airflow ventilation system in post-mortem rooms. Soluble salts of cyanide includes potassium and sodium cyanide, which are used industrially in electroplating and metal processing and as a laboratory reagent also. Less soluble salts of cyanide include silver and gold cyanide and mercuric cyanide, which also releases hydrogen cyanide on contact with strong acids. As a general rule, most cyanide suicide deaths are reported in those individuals, mostly males, who have occupational access to cyanide salts. Hydrogen cyanide may also be formed as a combustion product in fires from nitrogen containing materials such as wool or silk or synthetic polymers such as polyurethanes and polyamides. Let's study about the fluoride. Fluorides are organic and inorganic compounds containing the non-metallic element fluorine. Fluoride is an essential component for normal mineralization of bones and dental enamel, and it has been widely used to reduce the prevalence and severity of dental caries in children and adults. Toxicologically, important fluoride compounds include hydrogen fluoride and sodium fluoride. The major source of fluoride intake in the general population are water, food and fluoride containing dental products. However, the excessive intake of fluorides has been observed from environmental sources, including from drinking water with naturally high fluoride or from exposure to indoor fluoride air pollution from the use of high fluoride containing coal. Fluorides are readily absorbed from the gastrointestinal tract. Once absorbed, fluorides are rapidly distributed throughout the body. Fluoride is readily transferred across the placenta but poorly transferred to breast milk. Fluorides are mainly excreted in urine. Plasma and urine fluoride levels are related to a fluoride intake and are a biomarker for excess exposure, while hair, fingernails and tooth enamel are indicators of long-term response. Dental fluorosis, excessive fluoride intake from the water during the period of enamel formation in children can cause dental fluorosis, and in its mild form, dental fluorosis is characterized by white, opaque areas on the tooth surface. In its severe form, it is manifested as yellowish brown to black stains and severe pitting of the teeth. Inappropriate use of fluoride toothpaste and fluoride supplements in young children is a risk factor for dental fluorosis. Dental fluorosis is more common and severe in the areas of endemic environmental fluorosis. Let's study about the skeletal fluorosis. Long-term exposure to very high oral dose of fluoride or occupational exposure of cryolite dust can result in skeletal fluorosis. Cases of skeletal fluorosis are predominantly found in the developing countries and are associated with high fluoride intake coupled with malnutrition. Fluoride is mainly deposited in the neck, knee, pelvic and shoulder joints or bones, which make it difficult to move or walk. The symptoms of skeletal fluorosis are similar to arthritis and early on include sporadic pain, back stiffness and burning like sensations, pricking and tingling in the limbs, muscle weakness and chronic fatigue. Let's study about the chlorate. Sodium chlorate is an effective, inexpensive, non-selective herbicide. Potassium chlorate is used in both manufacture of matches and some explosive. Both compounds are powerful oxidizing agents. Serious and sometimes fatal poisoning can occur after the ingestion of 15 gram or more of sodium or potassium chlorate. Early signs of symptom of chloride poisoning include nausea, vomiting and abdominal pain. Systematic absorption leads to substantial oxidation of hemoglobin to form methoglobin, which may cause cyanosis, dysphonia, anuria and coma. Intravascular hemolysis and severe metabolic acidosis may also occur. Ingestion of potassium chloride may cause hyperkalemia. Let's study about hypochlorites. Hypochlorites such as sodium and calcium hypochlorites are used as disinfectants. Domestic products contain relatively low concentrations, whereas industrial products are much more concentrated and produce greater toxicity if ingested. Hypochlorite poisoning produces characteristic symptoms, and qualitative tests are generally not used for diagnosis, although they may be used to confirm diagnosis or in the investigation of fatalities. Let's study about the sulfide. Many organic and inorganic sulfide compounds are used in industry, but the most common cause of sulfide poisoning is by inhalation of hydrogen sulfide gas, particularly in industrial or waste disposable sites, including sewers. The gas has a characteristic foul odor of rotten eggs and has a very low threshold of 0.03 parts per million. However, very high sulfide concentration may cause paralysis of the olfactory nerves. Hydrogen sulfide occurs naturally in volcanic gases and hot springs. Hydrogen sulfide is unstable and is metabolized rapidly in the body, so that it may be difficult to detect in biological samples from cases of suspected poisoning. In cases of suspected acute or chronic exposure to hydrogen sulfide, blood specimens may be collected as soon as possible because of its rapid metabolism. It is metabolized into thiosulfate, and so measurement of blood or urine thiosulfate concentration may be the most viable approach to the investigation of acute or chronic sulfide poisoning. Let's study about nitrites and nitrates. Sodium nitrite and sodium nitrates finds use in artificial fertilizers, food preservatives and explosives. Sodium nitrite is also used in food preservative and in the manufacture of explosive and as a cleaner in dentistry. Nitrite has the additional property of causing vasodilation, which has led to its application in treating angina pectoris. This vasodilatory effect of alkyl nitrites has led to abuse of these drugs for the rush, disinhibition and muscle relaxation. Ingestion of these substances, which are supplied to be inhaled, can be fatal. Organic nitrates release nitrite ion when ingested and are also used as vasodilators. Symptoms of nitrate and or nitrite poisoning include nausea, vomiting, diarrhea, abdominal pain, confusion and coma. Nitrite ion in the body combines with hemoglobin to produce methemoglobin, which reduces the capacity of the blood to carry oxygen. Unborn babies and those up to 3 to 4 months old are particularly susceptible to methemoglobin anemia because they are deficient in methemoglobin reductase, the enzyme that converts methemoglobin to hemoglobin, and because their stomach are less acidic than those of the adults and hence are more likely to permit growth of nitrate reducing bacteria. Thus, if nitrates are ingested by baby, they are more likely to be converted to nitrites with resultant methemoglobin anemia, which gives rise to so-called blue baby syndrome because the skin appears blue. Forensic analysis of non-metallic poisons. There are several chemical experimental methods available for analysis of non-metallic poison. Some of those are, for example, borate. To a portion of extract, equal volumes of silver nitrate solution is added. A yellow precipitate appears which is insoluble in 30% volume by volume solution of nitric acid and slightly soluble in dilute ammonia solution. The portion of the extract transferred to an evaporating chamber. 1 ml of sulfuric acid and 3 ml of ethanol is added and the setup is ignited. A green border around the flame indicates the presence of borate. To a portion of the extract, an equal volume of silver nitrate solution is added. A yellow precipitate is observed. The precipitate is insoluble in 30% volume by volume solution of nitric acid and slightly soluble in dilute ammonia solution indicates the presence of bromide. About the fluoride, zirconium alizarin reagent test. On a spot plate, 2 drops of alizarin S 0.1% aqueous solution is mixed with 2 drops of zirconyl chloride solution, of which 0.1 gram of solid is dissolved in 20 ml of concentrated hydrochloric acid and diluted to 100 ml. To this mixture, 2 drops of extract is added. The change of color to yellow indicates the presence of fluoride. Let's study about the test for chloride, which is manganese sulfate phosphoric acid test. Take 2 drops of the extract and 2 drops of the manganese sulfate phosphoric acid reagent, which is prepared by mixing equal volume of saturated manganese sulfate solution and concentrated phosphoric acid solution. This is placed in a micro crucible warmed rapidly over a burner and allowed to cool. A violet coloration appears. Very pale coloration may be intensified by adding a drop of 1% alcoholic diphenyl carbazide solution when a deep violet color is obtained. Let's study about the test for hypochlorites. The test is potassium iodide starch paper test. To do this test, 1 drop of concentrated extract, neutral or weakly alkaline, is placed on potassium iodide starch paper. A bluish black color is produced. Lead nitrate test. 2 ml of extract is boiled with lead nitrate solution. A brown solid is found to separate. The third test for this is cobalt nitrate test. A few drops of cobalt nitrate are added to 2 ml of extract. A black precipitate is obtained. Let's study for the cyanide test, which is a Persian blue test. 5 ml of a freshly prepared 10 ml solution of ferrous sulfate is freshly boiled and cooled water is added to 2 ml of the extract. A greenish precipitate is formed. The hydrochloric acid is then added dropwise to dissolve the precipitate. A blue coloration or precipitate, sometimes precipitate is formed on keeping, indicates the presence of cyanide. The ferric thiocyanate test to detect the cyanide. 1 ml of ammonium polysulfide is added to 5 ml of the extract. The mixture is evaporated to dryness. 1 or 2 drops of dilute hydrochloric acid is added. It is allowed to cool. 1 or 2 drops of 3% ferric chloride solution is added. A red coloration is obtained. Let's study this test for sulfide. First test is sodium nitroprusside test. 1 drop of alkaline extract is placed on a spot plate. 1 drop of 1% freshly prepared sodium nitroprusside solution is added. A violet coloration appears. Methylene blue test. 1 drop of extract is placed on a spot plate. 1 drop of concentrated hydrochloric acid is added and mixed. To this, few grains of Para-ammonio-dimethyl-aniline is added, followed by a drop of 0.45 molar ferric chloride solution. A blue clear coloration appears within 2 to 3 minutes. Let's study for the test for nitrite. Indole reagent test. A few drops of the extract are placed on a semi-micro test tube. 10 drops of indole reagent, which is 0.15% solution of indole in rectified spirit, and 5 drops of 0.8 molar sulfuric acid are added. A purple coloration is obtained. Let's study for the test for nitrate. Brucine test. A few drops of test solution are placed on a spot plate. A drop of concentrated sulfuric acid and a small crystal of brucine are added. The mixture is stirred with a glass rod. A blood red color is produced. The test for phosphate. Ammonium molybdate test. 2 ml of extract is mixed with 2 ml of ammonium molybdate solution in a test tube. A few drops of concentrated nitric acid is added and warmed. The appearance of a canary yellow precipitate is obtained. Let's summarize what we have studied. That anions form an important but disparate group of agricultural, household and industrial poisons that present many difficulties in their systematic chemical analysis. The important poisons in the group of non-metals or specifically toxic anions include borate, bromide, chlorate, cyanide, fluoride, hypochlorite, iodide, nitrate, nitrite, oxalate, bromate, iodate, sulfide, thiocyanate, etc. Some anions can be trapped in combination with a stable cation, after which the organic matrix can be destroyed with metals. Many anions are unstable and undergo rapid breakdown in the stomach and gut after absorption. The analysis of metabolites and various hydrolysis products in blood or urine using modern methods is not well described. Classic analytical methods like color test may still be applicable for cases in which stomach contents or residues are available. Fluorides are mainly excreted in urine. Plasma and urine fluorides levels are related to fluoride intake and are a biomarker for excess exposure, while hair, fingernails and tooth enamel are indicators of long-term response. Hydrogen cyanide is a highly toxic volatile liquid. Fumes of hydrogen cyanide are given off when cyanide salts are mixed with acids or produced in the stomach following oral ingestion.